And okay, recording is on. So I'm Marsha McInnes. This is NAMI Tri-Valley's general meeting, and that means the format is that we invite a special guest in at least 8 times a year, and always on the first Monday of the month, unless there's a holiday, and there are several on Mondays that throughout the year. So again, let me, there's something in my way. There we go. Okay. So tonight we'll wrap up for 2021. So we did it a full year on Zoom, and it was actually easier than I thought it might be. And with the help of Lois kind of in the background, I can't thank her enough. I'm able to conduct this meeting seamlessly without having to stop and read everything. So thank you, Lois. I just wanted to mention that we will keep all of you informed on our guest speakers for next year. And if those of you who are here for the first time and you would like to give me your email address for future meetings, just let me know, because everything we're doing still is on Zoom. We're not quite there yet, but I do believe that we will, maybe in a year, we'll see each other face to face. That's my goal, hoping that we can truly, for those of you who've dialed in during this whole Zoom episode for 2 years or a year and a half, it'll be a pleasure to meet you face to face. So with that, tonight we have a very special guest. I'm very grateful and excited to have Access Community Health here, and Dr. Theresa Rizzo, who will talk about Access Bridge Mental Health Urgent Care Program. And I think I'll just keep it at that and get you started here. And I'm looking, where are you here? There you are. Okay, I see you. A lot of faces. And do you need any access to the I mean, are you running a PowerPoint or anything? And
no, I'm pretty low tech.
Love it. So welcome, Theresa, and
thank you.
We're happy to have you here. Thank you.
Thank you for inviting me. I'm Theresa Rizzo. I'm a licensed psychologist and also the administrative director for IVH services at Access Community Health. Access Community Health, for those of you who don't know about us, we're a federally qualified healthcare center located in the Tri-Valley in Pleasanton. We also have a clinic in Livermore and a dental program in Dublin. And we've been providing quality, affordable, accessible, and compassionate healthcare services for almost 50 years. We have an integrated care model, meaning that we include a lot of different types of services. So we have pediatrics, women's health, adult health services, dental care, chiropractic, acupuncture services, and behavioral health care services. So currently we have a large team of over almost 20 therapists right now, and a team of care coordinators as well. We treat and assess individuals and families ages 5 and up, and a variety of mental health disorders on an outpatient basis. Many of our clinicians are also trained in EMDR, which, if you don't know, stands for eye movement desensitization and reprocessing, which is an adjunctive form of treatment for trauma. We offer enrollment and assistance for Medi-Cal, Covered California, CalFresh, Medicare, and Health Pack. We also offer services on a sliding scale basis. So our therapists are providing assessment and treatment for mental health diagnosis. We also have a team of care coordinators who assist us with case management services and referral needs to community partners. We also recently started developing a psychiatry program. It's on a limited basis right now, short term, and we're doing right now currently only internal referrals only because we have such a limited time with her. We also provide neuropsych testing for our patients. And we also just recently partnered with the UC Berkeley sleep team to develop a sleep coaching program within Access as well. But we saw a really strong need in the Tri-Valley area for more assistance with access to mental health care. So we went to the cities with a program proposal and received funding to develop an urgent mental health care program for that purpose. We started Access Bridge on July 1st, and the Bridge program provides access to rapid treatment for the residents of Dublin, Livermore, and Pleasanton. Again, also ages 5 and up, regardless of their insurance type or lack of insurance. So this really does provide kind of more urgent-based mental health needs. The program consists of a therapist, a care coordinator, and a psychiatrist. And patients are assessed to determine their level of need, and they might be allowed up to about 5 sessions for the purposes of stabilization and crisis management, with the ultimate goal of linking them to longer term services. So we kind of provide like a little cushion to help them get to where they need to go, work with their insurance provider, figure out if they need a partial hospitalization program or any kind of higher level of care than we can provide in our integrated care model. And since we opened, we've helped more than 100 individuals avoid hospitalization and get connected to mental health services. The average age of the calls that we receive are about 16 to 35. And I think it's often because we do offer those afternoon, after school hours and evening hours for those individuals who work. All of our mental health services are currently being conducted by a telehealth. It's, I think, the new model these days. We do have a video room available at our clinic for those who don't have access to a computer or a smartphone at home. We also offer drive-up telehealth, where individuals can come and park in our lot, use our Wi-Fi to have a safe place that they can conduct their sessions if they don't have any privacy at home. So they can either use their own smart device, or they can use one of our iPads for those types of meetings as well. So we're really trying to think, outside the box to get people the care that they need. Currently, our Bridge program hours are Monday through Thursday, 11 a.m. to 7 p.m. and Fridays from 9 a.m. to 5 p.m. Our Bridge program phone number is 925-568-2080. And right now, currently, our services are only provided in English. And with our assessment, we really try to determine whether it's the individual is at the level of care that we can meet, kind of more in that mild to moderate range. If they do require any type of escalation, we try to contact the hospitals and things like that. But right now, we only have the capacity for mild to moderate. Our clinic phone numbers for integrated care is 925-462-1755. Otherwise, people can go to our website at www.accesshealth.org. Are there any questions?
I have 2 questions, if that's okay.
Sure.
Do you have statistics on which city or how many people are calling from Livermore, Dublin, and Pleasanton, and which city has the highest amount of people calling into this program?
Right now, I don't have the data about the statistics. I would say that we get probably 3 to 4 calls at least a day from from residents. We're not necessarily tracking like which cities they're from, just as long as they're from one of those cities. But I don't have the specific data. I can get that to you if that's something that you're needing. I just don't have that at my disposal right now.
Okay. And then the other question is, if someone is calling and you would determine that they're moderate to severe, is that linkage over to Valley, or is that
It could
some
be
other protocol?
It depends. If they don't have any insurance, it may be about getting them access to insurance or having them call the Alameda County Access Line to get a more intensive program. If they have private insurance, we try to work with their insurance program to find the level of care that they need. So it really just depends.
Okay, thank you. It looks like there's some
Questions in
on
the
the
chat.
Okay, can I use the services for my brother if he and my mom live in Oakland?
That's a good question. Unfortunately, right now, the program, they have to have a residence in one of the Tri-Valley cities, Dublin, Livermore, or Pleasanton right now, as the way that the program is current, because we receive funding directly from those cities. The phone numbers again, yes. The Bridge program phone number is 925-568-2080. And for the Access Clinic itself is 925-462-1755. If they don't have a residence, I think that they can claim to be homeless in any city of their choice. It just may not be, because we can't see people in the for the urgent care in the clinic itself right now, just because of the telehealth model that we're following. So if they have another need, we may have to kind of assess that they can, come and use the video room to get access to those services.
Okay, there's several other, I see a hand up for Julie, and there's another chat question. So Julie, do you want to ask your question?
Yes, very excited about the Bridge program. It's wonderful to have that resource available. When you were talking about the insurance, I just wanted to check that I didn't misunderstand. Bridge is open to everyone, regardless of insurance, private insurance, no insurance, lots of insurance.
As long
Insurance
as they're
is not a
from
barrier.
Dublin, Pleasanton, or Livermore, yes, correct. The Bridge program we've kind of opened up the services in that regard to provide. So if they have Kaiser insurance or Blue Cross or Blue Shield, those are kind of insurances that we have as well. We get a lot of people who are not insured, and we're trying to get them help and get them insured. So yeah.
And are you seeing, the last report I saw was very early, right after the opening, and we weren't yet seeing people with private insurance. Are we now seeing that? Are you getting
we do. It's certainly not the majority. I think the majority of people that we are still serving are people who are not insured at all. But I think we see people, I've seen people from Kaiser and as well as Blue Shield have come through our doors for the Bridge program, and we have been working with those insurances to get them reconnected, whether they've temporarily lost their insurance, and getting reestablished and reconnected to their insurance programs.
Okay, and what Bridge does is the warm handoff to make sure that Bridge just does some initial contacts and then make sure that they works as a caseworker to get them in other services. Is that right?
Yeah, it depends on their needs. So if they have other needs, other referral needs, housing, resources, food assistance, depending on other things that are going on for them, we do work and try to provide access to those referrals. to get them connected to other programs, domestic violence shelters. So whatever it happens to be, we're trying to provide other referrals as well.
Wonderful. Now, do you get, these are all individuals who, where have they learned about Bridge? What brings them to you? And are you seeing people coming to you that are being referred to by the cities themselves and law enforcement? And are you seeing anything, those kinds of connections?
I think that we have answered some questions when the city does contact, or the police have contacted us about certain individuals. Depending on the level of care that that person needs, they may or may not be appropriate for our level of care. So some people do need a higher level of care initially, and we recommend they may be better served in a hospital ER. Because we, like I said, the level of crisis is, we're trying to prevent that hospitalization, but if they're really at that point, a hospital may be a safer place for that person. So it just depends on the person and their capacity to participate meaningfully in the services. So if they are not able to participate, they can't answer the questions or participate in that way, then they may not be appropriate for the services and may need a higher level of care. So we do have our therapists are doing an assessment, and I would say the majority of the people that have been calling, we've been able to help, but there have been on occasion either immediate referrals to the hospital or a higher level of care, just depending on what the presenting issue is.
And in the early discussions, it was possibly early COVID or possibly even pre-COVID. There was Access Bridge was going to have I don't remember what it was called, but an actual room where someone could physically kind of regroup. That isn't at all a part of the program any longer?
We don't have like a room where they can stay. We have what is a video room. It's a room with a computer that they can access the therapists who are off site right now via telehealth. So we have that room as a capacity for them to reach those services, because we're doing everything via Zoom and Doximity and things like that. So having access to a computer, whether it's a smartphone or a computer, and we do have that service for some people who have not been able to or don't have access to themselves. But no, we don't have the capacity or the staffing right now to contain people or have them to kind of just show up right now in the clinic.
Okay, thank you. That's all I have. Really appreciate having this resource. Thank you.
I'd also like to bring in, there were a couple of questions on chat.
Okay.
One from Christine that is asking if the Access Bridge, no insurance considered. Is that true for Access Community Health in general? So
for Access Community Health, for our integrated care model, we do see individuals with primary Medi-Cal, Medicare, Health Pack, and also a sliding scale. We currently don't accept any private insurances that I'm aware of. So Bridge is kind of unique in that it's regardless of insurance type or lack of insurance. And for the Access Integrated Care, it can be anyone who's in the Valley. We do see individuals who have Contra Costa Medi-Cal. So if they're living in like the San Ramon area or Brentwood, they have been seen in our clinic. So it does open, it's a lot more flexible.
The two more questions. This is from Amanda. Is there something in Oakland or East Bay like this service, meaning the access bridge? And her second question is, what do you do when someone refuses treatment?
As far as other community clinics, there are, I believe, clinics in the Oakland area, the Tri-Valley area. I think that there's Bay Area Community Health is another federally qualified healthcare center. There is Lifelong, I think that works kind of more in the Berkeley area. I don't know about the urgent care. I think we're kind of unique in that sense. What do we do when someone refuses treatment? We try to, encourage them to maybe reconsider if we really feel like they need care, but unfortunately, we don't mandate treatment for anyone. It's kind of a voluntary thing. They have to be willing to participate for them to be getting any benefit. So yeah, that's a tough thing. We have been working with some families, and that's kind of an issue sometimes if the family wants the person to get treatment, but maybe they're just not ready. Unfortunately, we can provide support and help to the family, but the individual, until they're ready for treatment, there really isn't much we can do.
And then the last question is, what if they don't think they're sick? Is that right, Amanda? Is that right? Okay. What if they don't think they're sick?
Yeah, well, if they don't think that they're sick, they probably won't be presenting for services. If they don't think there's anything wrong with them, if they're just showing up because they think they're doing something that a family member wanted them to do, they may or may not get benefit. It depends on how forthcoming they are. Like as therapists, we're not trained to be mind readers. We don't know what's really going on other than what people tell us. And if they aren't telling us the truth or aren't telling us how difficult things are, it's sometimes hard for us to help them. And that's definitely a challenging aspect of treatment when people are kind of in denial about the problems that they're having. But we try to, have a really open approach. We might recommend, but again, it's until people are ready for that treatment. We may work, with some motivational interviewing to help them maybe decide that, well, yeah, your family member told you to come and here you are, but what do you want to get out of this time? Like, what are you hoping to get from this? And try to kind of get some buy-in from them to see if we can help them or what they're wanting and see if we can help them reach those goals.
I just sent the flyer, the Access Bridge flyer to everyone. So,
Marcia, I don't know if you can see, we have Amanda with her hand up, Armine with her hand up, and Julie with her hand up.
I did not see that. Okay. Okay. Amanda's is off. Julie, are you still have more questions? Yeah, I mean, I want
Armine is next, but I did want to respond to
okay.
Amanda.
Gotcha. Okay. Armine.
So one of the things I wanted to ask is this, only individual or group sessions possible? First.
For right now with Bridge program, we do individual services. However, we also have had some family involvement. It just depends on the situation. So there have been times where we've met with the patient and the family together, so that the patient's providing information, but the family is also providing information to the therapist. It can get kind of a little crowded with everybody sitting around, but that has worked. We're not really set up to do Bridge as a group model yet. So it's mostly individual and family services. However, in our, we have run groups in our IBH. In the past, we have had a mindfulness group, a chronic pain group, a depression group. These have always been in a stage of, where we are in the program. I think right now we are running a group that's connected to Tri-Valley Career Center with supporting people while they're looking for work. So that is a partner group that we're co-facilitating. One of our therapists is co-facilitating. We also have one of our therapists is also partnered with Pleasanton City Schools and is running like a group for the middle and high school students there. And we also have a contract in some of the other schools like in Tracy, as well as in Dublin High as well. So we have some counselors that are working in the schools as well.
So our loved one, the consumer, for example, can sign up with many, many different sessions going on. Let's say they're seeing a therapist, they can also go on a mindfulness session, they can do different things. Is there a limit? Who defines that limit?
Well, I think with access, the limit is provided by the insurance. So Medi-Cal right now, we can see individuals, I think up to they have up to 6 sessions a month within that mild to moderate range. I think if they need a higher level of care, meaning they need more frequent services, then we would refer them to access. So yeah, so it with a combination of those types of things right now.
So, but you said earlier, so all of us here in mental health, there's one thing we all have in common. We go through periods or pretty much all the time. There are loved ones mostly in denial, right? And family picks up a call. God knows how many times they say, ma'am, your son has to call,
Yes.
Even just ask questions, right? So they are nowhere near picking up the phone and calling. If I set something up and I get him to go, he may sort of kind of say yes. We're all hoping and praying that somebody's going to get through them. I mean, they got to be ready, but it's just like we're always asking the question, when is that switch going to go, if ever, and how and why, Right.
I think it depends on how willing they are. If there's, if they're willing to sign a release of information, allowing us to talk to family members, we're certainly, willing to engage with family members and, trying to get support for the family. But in order to treat an individual, we need that individual's consent to participate. And if they are an adult and they're able to consent to their own treatment, then we, by law, we're required to have their involvement and their consent.
And all the sessions are 9 to 5 weekdays, right?
For the Bridge program, it is Monday through Thursday, 11 a.m. to 7 p.m. and Fridays from 9 a.m. to 5 p.m. Our regular clinic hours are 8:30 to 5, although we do have some clinicians who also work later hours as well. So it's generally 8:30 to 7, I would say, is a lot of the available appointments. And I think a lot of our clinicians who see children and adolescents have a lot of their hours, right after school, and evening hours are the ones that kind of go pretty quickly because a lot of people want them. And then we do have morning appointments as well.
Okay. And you said everything from mild to moderate. If it's moderate to severe, you don't touch.
It's depending on the person's level. If they need a higher level of care, sometimes we do, or we are able to kind of on a short-term basis work more closely with an individual, like have like 2 sessions a week for, if it's a crisis that we're working with, and that's not necessarily a means to discharge them unless they're needing hospitalization, but generally mild to moderate. Yeah, that's the level of care that we see.
Thank you.
Hey, Julie.
My name is Julie Testa, and I am a board member with NAMI Tri-Valley. Marcia, may I also address the program that is soon going to launch in Pleasanton that I think will build on this exciting program, Bridge, and I think it'll answer some of the questions that have been asked by Amanda and Armine. Do you mind if I share that?
Sure.
I am Vice Mayor of Pleasanton. I am excited that tomorrow night on our City Council agenda, we are talking about a crisis response program that we've been working on for several years. It comes with it it wouldn't exist. We wouldn't be talking about it if it were not for Tri-Valley NAMI. And it will be limited to Pleasanton, sadly. So I think both Armene and Amanda, it may not be the answer for you, but Amanda, I believe that there is an IHOT program in Oakland that might be a good possibility. So the program that we're talking about for Pleasanton will be specifically a program that will include clinicians, that they will be responsible when there is outreach from a family to actually go to a home and interview and work with a loved one and try, and it is specific to our loved ones who, I see anesthesia in the comments, who don't recognize their illness and are not willing to come and seek out care. So we are working to hire clinicians that will actually respond to a request from family members to go to a home and try and open up that dialogue and try and find what resources could help that person and develop a relationship to help them recognize what resources might be available, and perhaps someone outside of the family, a trained clinician, might be able to make that connection that the family isn't able to. So it will also be a team that when someone is having a crisis event in public, the clinician, along with a law enforcement officer, will arrive so that it is not simply a law enforcement response to a crisis situation. And we're looking at how we can better serve our families who have a loved one in crisis. So we're pretty excited about the potential for this program. We think it'll work well with the Bridge Urgent Care is something that many of us had been working on. Marcia played a role in it. I played a role in it. We're so grateful that it's come forward. And I'm also working with our local assemblywoman, Rebecca Bauer-Cahan, on her 988 and crisis response. We're not going to have all the answers, but we're really working to support our families and look at crisis differently. Look at it as a community and a medical response. So there is hope out there. Pleasanton is having conversations with our neighboring cities to try and encourage them to join us in this program. So far, they have not been interested in doing so. But Amanda, I do believe that there are some programs in Oakland that perhaps you can look at. I do think the IHOT program, Marcia, don't you think the IHOT would be something you?
Amanda is just saying it's not working in their case. So there are other possible, and I will defer to Lisa on that for Oakland, since that's her area, on resources. And so that's pretty much my answer on that particular situation.
Yeah, maybe Lisa could provide some thoughts.
It's complicated. So as all our,
it's always complicated. Yeah.
Complicated, right?
Yeah.
Yeah. Okay. Thank you. I think there's one more question on the chat. I don't want to lose track of that. Can any resident of Alameda County use the integrated services of Access Healthcare aside from Bridge?
Yeah, like I said, we do offer a sliding scale, but we we see individuals that are covered via Medi-Cal or Medicare and Health Pack.
I don't think everyone knows what Health Pack is. I do, but Could you just share that with us?
Sure. Health Pack is a coverage for individuals who are undocumented. It's like a low-cost health program for low-income individuals who live in Alameda County. They have to apply and be approved to get Health Pack coverage.
And is income play into this at all, or is it?
I believe it's a limited, I don't know exactly what the limit is, but I believe it's they have to fall in a limited income range.
Okay, thank you. Okay. Does anyone have any other questions?
There's another one in the chat.
Oh, thank you. That was quick. Let's see, let me keep going down here. Can Access offer therapy for family members trying to cope with their loved one or refer to an appropriate therapist?
That's a good question. Because primarily the way that our billing system is, we do have to meet medical necessity for treatment. However, with family members, I know that sometimes gets complicated. So it's possible, but we also can try to find other referrals in the community as well.
Do you have a psychiatrist on staff?
We have a psychiatrist who we have hired for the Bridge program, and she is working very limited hours within our clinic. Right now, we're only working, she's working on a kind of more of a short-term limited basis, getting people kind of stabilized on medication, and also kind of referring back to either their primary care doctor or referring to a community partner.
Thank you. Any other questions? This is
Yeah, there was another one in the
okay. Okay, does anyone know anything else besides IHOD in the East Bay, Oakland? Just checking again. That's where I would, Amanda, please check with Lisa. And I would really encourage you to connect with her, and she can actually sit down with you and metaphorically as COVID and all, or I don't know, maybe you can meet, but go through what might be appropriate avenues to go on in your particular situation. Is that okay? Great.
Yeah, I had messaged her as well already. So
Okay, great. Okay, any other questions anyone might have?
one more in the chat.
I'm sorry, I heard something.
There was one
Oh,
more.
one
in the
more?
chat.
Okay. Is the Bridge program a permanent thing?
Question. Right now, it's a pilot program. We hope to continue the program, help us maintain funding, that the cities are, we're sharing the data that we have, that we're gathering. And as it kind of starts to pick up a reputation and some steam, we're hoping that we'll be able to even help even more. So unfortunately, I don't know, but not currently, no.
Okay, so what's the routine? Someone calls you or calls a staff member, and how is this? How many minutes is it? How long does it take for someone who's in distress, to contact with someone and have a conversation and find out what's going on?
Good question. So right now we have a wonderful care coordinator. Her name is Shane. She's the one that's been answering the bridge phone line. And when she's busy on the phone, we have other care coordinators that are kind of like her backup for the program that work in our IBH, but kind of back her up when it gets a little bit busy. So she will take the initial call, depending on what the person's wanting, may ask if the person wants to speak to a therapist. And just, we'll determining and what time it is. If there's a current opening in the schedule, we'll try to get them in that same day usually, or the next day, to have them assessed, even if they're talking for like 5 or 10 minutes with a therapist that same day, and then we're doing like maybe more in-depth conversation the next day. But yeah, generally it's pretty quickly.
Thank you.
So there may be other referrals that the individual might need. We're working right now with Stanford Valley Care, and we are getting some referrals for people who have been to their ER and meet the criteria, which is a resident of Livermore, Pleasanton, or Dublin.
Another question. Do the bridge services have to be initiated by the person with the illness, or can a family member do the initial contact?
I think if the family members can certainly call and get some information about the program, but generally we want to have the individual call us to get connected, or at least try to participate. But if the family member is helping to coordinate, that's okay. I will eventually try to get the release to be able to kind of work it all together. So if the person is cooperative and wants to, but needs a family member to help them, then we'll, certainly try to help the family member get them connected.
Do you have NAMI Tri-Valley's information, and do you refer people over to us, especially families, for the support groups and programs that we have?
Absolutely. Yeah, we certainly as an option for family members, try to get family support. There are, Shane has a list of other referrals, organizations, other groups, grief groups and things like that she's been gathering and collecting as well. So I think it just depends on what's needed. So we may not be able to have that service, but we may be able to kind of link them to another service or recommend they try something else if we've heard about it. So if you have any great referrals, we'd certainly welcome them too.
Thank you. Okay. Any other questions? I mean, it's so rare that we get this opportunity with Access Community Health. I don't want to let you go. I don't want to end this early either. So Christine.
Hi, I know this is supposed to be related to Bridge, but I live in San Leandro and I can't take advantage of that for my son. I have questions about Access, the integrated care that Access Health Care delivers. Can I ask it, or?
I can try to answer the question. If I don't, maybe I can get back to you and follow up with you another time if I can't answer it right now.
My son's recently got Medi-Cal. He has sort of disparate healthcare providers here and there from his father's kind of independent insurance. And I'm just curious about when I looked at accesshealth.org, I didn't see psychiatric care listed there. So I'm curious how you integrate everything and what does it cover?
Yeah, so psychiatry is certainly something that's pretty new to us. We haven't always had a psychiatrist on staff. So we often refer out to, to other partners. I think depending on the level of care that the person needs. Pathways to Wellness is one that we've referred to, or through the Alameda County Access Line. We also refer many people to community psychiatry as well.
That's the name of a group or program? Okay.
Yeah. And they accept individuals with Medi-Cal.
Okay, anyone else?
Question.
Lisa?
You mentioned that you're going to be talking about this tomorrow. Sorry, I'm going to find Julie. You were talking about this tomorrow in the meeting. Is that an open meeting?
It is a public meeting. I would love for everyone to join in. In fact, you know what I'm going to do? I'm going to pop into the chat the link to that item tomorrow night. You can do a copy paste. I think it'll take you straight to the staff report and give you information on that item and what we will be discussing. Tomorrow night, we will discuss and hopefully approve the funding, $800,000 to start the program. The program would not start until July, but we think that's pretty exciting. The program could start in July. We are working on hiring, well, it's got to get, the funding will get approved tomorrow, fingers crossed, but as many people as who show up to say we need this, we will help. And it's been, here, okay, I'm going to pop it in before I get sidetracked. Do a copy paste of that, and it should take you directly to that staff report. So if you want to ask any questions of me right now, briefly just to know, or go in and read that staff report. It isn't the program that I think it should be ideally. So I would love to have feedback from all of you who I think will see what I think is the less than perfect aspect of it. But I am so excited because it is just such a quantum leap into something and going in the right direction. So I would ask for support from everyone on it, but I would also ask for feedback on how we can make it more perfect. And that is, I believe it should be a truly straight up medical response program as opposed to a law enforcement response program. So take a look at it, give feedback. Christine, thank you. Yes. All right. Anyone, anyone who wants to contact me, feel free. I can put my contact information in there as well. But it is a Pleasanton program. We would like to expand it. We feel, of course, for our community to be healthy, we want our neighbors to be healthy. We want all of our families to have the support that we need. So.
Thank you, Julie. And I might mention, and Armine, I see your hand up, that I will be making a statement representing NAMI Tri-Valley supporting the this service in Pleasanton. And Dr. Rizzo, I promised Sue Compton that we would get the word out on the bridge program. And that is exactly what we're going to keep doing. This is a pilot program. We want it successful. We need it. We truly need it. Armine, oh, you're muted. There you go.
Sorry, I'm glad you said that. That was a great transition because I know it's a pilot and it's also online, right? So do you have any plan, any idea to have face-to-face? It's all depends on COVID, I'm assuming, but still.
Yeah, right now, I mean, that as like in the clinic, I think that on the medical side, I think they are slowly starting to open up and see more, in-person visits face-to-face. Right now, however, our behavioral health program is still telehealth. And when they make that decision to have us all come back, I think that it may not be, we've been wondering when that's going to be happening for a long time now. And I don't have the answer right now. When they decide that it's necessary for us to come back, I think we might come back and do more in-person visits. But right now, unfortunately, everything is still telehealth.
So going in as a pilot, do you know what's the time period given? Is it 6 months, a year, or there is no time limit?
I believe the program is funded for the next year, so we're certainly looking to show that it's a a viable program, and we want to continue it after that. So yeah, that's the plan.
So if my son is seeing a psychiatrist with Pathways to Wellness, they can call and see a therapist in Access through the Bridge program.
Well, the Bridge program is, it's there to be a bridge, right? So if they don't currently have services, it's a kind of like a short-term brief model, and the goal is to get them linked to longer-term care. So it's not like a long-term program. It's really about providing that service as a bridge to get them connected to longer-term care. So if they're already connected to Pathways, but say their Pathways therapist is out of, not present or sick, or something happens and they can't reach anybody, they might be able to kind of call and access those services just to be able to talk to someone and get some stabilization. But then we would refer them back to Pathways kind of thing. So that's kind of how it might be, although generally, if they're currently getting services already, we don't want to necessarily duplicate those services.
Okay.
So we really, it's kind of there primarily to provide support to get people to care, so that longer term care. So whether they have Medi-Cal insurance or whether they don't have any insurance, it's maybe getting them enrolled and helping them apply for Medi-Cal so that they can get insured and then get more access to care. Or if they are waiting they can't be seen at Kaiser for 8 weeks, we might be able to, but they're having a crisis now. So we might kind of work with them, assess what's going on, and then maybe reach out to Kaiser and saying, what else can you do? This person needs a sooner appointment than 8 weeks. So we might also try to push back at Kaiser to try to help get them seen at Kaiser sooner than 8 weeks.
Okay, there's a question from Nisha Beckton.
Hi, thank you for that. Hi, Theresa. We haven't met officially, but nice to meet you. I'm actually the CEO for Pathways to Wellness. And one of the things I want to say about kind of the clients being seen in both our facility and yours, you make a good point. They can't really be seen in both facilities, but Pathways has a specialty mental health contract. So we serve individuals who are experiencing moderate to severe mental health impairments. So, and I believe Access actually does just the opposite, moderate to mild. So there is a difference. So if a person is in our program and in your program, then they would be in 2 different levels of care. So I don't know how that works. My understanding, you can't do that.
Correct. And we are, we're trying to assess the situation, especially if we don't know someone. We may do an assessment and kind of crisis because they're calling us, and then we might do some investigation and find out, oh, they are connected, or because the therapist is assessing them, we really see, oh, this person has a higher level of care, higher need. We might, that's when we're going to actually, refer them. So sometimes it's really about, how the assessment that the therapist is doing to determine where they need to go, whether we can help them or whether they really need to go, to Pathways. So sometimes we won't necessarily know from that initial call, but we might need to talk to the therapist for that initial assessment. And then we kind of, again, if they do need a higher level of care, we'll kind of refer them through Access or Pathways to get that kind of fuller wraparound services that you provide for people who need more intensive services.
Correct. And our services are primarily the medication support services. Our contract is with Alameda County is truly like 85%, 90% of our contract is for the psychiatry piece. And they may have maybe 6% of our overall budget is allocated for therapy. That's how Alameda County has always had it designed.
Yeah. And if so, that's kind of so we do, while we do have some for Bridge, we have that short-term psychiatry service. If people need kind of more longer-term maintenance, that's when we would refer. If they need a higher level of care, we would refer to Pathways. But if they're more mild to moderate, that's when we refer to community psychiatry.
Okay, perfect. And maybe we can figure out a way to, if there are clients who need therapy, maybe there's a way we can connect and figure out with Alameda County, how could there be a way where you guys could provide those therapy services? That is a legitimate question because there are a lot of people, especially right now during the pandemic, who do need the therapy services. I would be totally in support of, supporting that too, just as a side note, to make sure that the clients got ultimately what they needed.
Okay, thank you, Nisha.
You're welcome.
Really. Thank you both. This was great. Thank you, Nisha. We pretty much everyone here, if not used and familiar, we're grateful to Pathways to Wellness. And
Thank
I'd like to plug in, it's not just a Pleasanton office. We needed a different therapist, and Oakland worked best, and a lot of time for our loved ones. It's also clicking with the doctor, so
That's right.
thank you.
Thank you.
So what I wanted to know, like, let's say he's seeing a doctor in Pathways to Wellness, a psychiatrist, can he go to Access and get the DBT or CBT kind of treatment therapy?
Absolutely.
That's what you were talking, right? Okay.
Mhm.
Because we got some help also. We actually got some support while in Pathways as well. It is just trying to make sure, like, we're holding him, and it's a tough battle. Like every month, we're trying to convince him, right, he needs a shot. But anyway, so thank you both. Just wanted to know. So
Very
Theresa,
welcome.
do you have DBT certified therapist?
I don't know. I mean, we're certainly DBT trained. I don't know about DBT certified. I know that I have used DBT in my therapy as well as EMDR with my patients that I see. And I know that we do, but it's really more of a, depending on the individual therapist, but I don't know if there's anyone specifically certified on our team right now.
Okay. And how many therapists do you have that they have a choice? If they go online, they can see the bios and all, right?
Correct. We just hired a few, and I think that they're up now. I believe we have almost 20 therapists right now, including the bridge therapists that we have hired. So it's a pretty robust team.
Can you drop us a link of where to go, where to find those therapists?
Bios?
Mhm.
Sure.
I dropped a link for the bridge program, Armine, which can link you back to the homepage of Access Community Health. There's another question. What are the services offered from Pathways to Wellness? So
Sure. Services that are offered would include, first and foremost, the medication support services. We have crisis services. We have mental health services, which would include collateral speaking with other hospitals and FQHCs. We have case management, brief case management services to link clients to housing, emergency shelter. Maybe they're looking for jobs, we'll link them to other programs. So, but primarily it is the medication support services. We, have psychiatrists and psychiatric nurse practitioner and physician assistants and clinical pharmacists. So our team is really the folks who focus on specialty mental health so most of our folks that are being referred from Access are coming straight from John George or coming right out of Santa Rita. So we spend a lot of time working with those two.
So I guess another question is, do you offer services to East Bay and Oakland? Honestly, Nisha, we got to invite you back next year.
Yeah.
And then separately, Access Community Health. So we got you both, I hope, for our presentation. So
Yes.
I'm sorry, go ahead.
I'll be happy to come back. But yes, we offer services in Pleasanton is probably one of our smallest locations. We also have our overflow for Kaiser. We provide services to individuals with Magellan, MHN, UBH, and then primarily Medi-Cal, Medicare. All of our providers are Medicare credentialed. We also have a facility in Union City, and we have Oakland as well. And we're about to start a pilot program, which will be for emergency services, same day appointments. So we're going to carve out slots so that more people could get access to medication support services right away when they need them, due to the influx. It's just, I don't know, the numbers have almost tripled, and we have a capitation on our contract, but I was recently approached by the county to figure out if we can help to design a pilot to be able to preserve slots for people. Right now, our priority are folks coming right out of the hospital so that when they get discharged from John George, they do not go without the necessary treatment and end up back in John George. So what happens now is I have a special line just for John George, a telephone line. When clients are being discharged from John George, they can call our basically a direct line to intake, and we give them an appointment before they even leave John George, so that we can help put that safety net in place. And so now we're going to be starting another pilot to see how we can help people sooner and faster. We're going to have an intake physician who will be joining us next month.
Thank you.
Mm-hmm.
Let's see. Armine, were you still?
I just wanted to add something that is awesome, because most of us who've been through the revolving door, right? The thing is though, the missing link is that's great. We have the doctors, we have the hospital, we need the social work, we need someone to follow them. Otherwise it drops. I mean, the most of us here, the family members that are on top of it, and we know how hard it is and we cannot do it ourselves. I chose, thanks for Marsha's mentorship, through the years, I'm finally becoming the mom and not the social worker, because as the mom, my powers are, different, I get the short end of it. But do they talk to you about having a social worker involved for the wraparound service, basically?
We, for Pathways, what we have in our contract is brief case management services. There's one dedicated case manager for each location. That's what the county gives us. We do brief, yeah, we do brief, but we do close to 30,000 visits a year, and we have 3 FTEs, one in each location. Yeah. So because where the county is electing to put the funds is with the psychiatrists and nurse practitioners, the people that they're going to need to be able to do the psychiatric evaluations, to be able to provide medications where needed and prevent, further hospitalization, so we can help to stabilize. We do a number of injectables too. We've really stabilized we reduced the hospitalization rate significantly from fiscal year 1920 to 2021, and now 21-22. So we report on clients that have been with us and how many hospitalizations we're reducing and keeping people out of jail. So, but we do some brief case management, and brief case management, I use that word a lot because I like to say it really is brief, because it's not a lot of resources for it. However, it doesn't mean we don't hustle to make sure we get it done. I think I was sharing with Marsha not too long ago, for the past 2 weekends, I've been spending time trying to help get a client out of her place that is infested and into a motel while the landlord handles his piece. I contacted Section 8, and we've been making sure she gets food and she got housing. So now that's why I'm kind of late to this call, because we got her moved back into her place. So we do whatever it takes to get the job done, because she also has cancer and some other medical conditions and a severe mental illness. So people need support. They really need support right now. So we just have to roll up our sleeves and get the job done, and then advocate to get more resources in the area of social work. I'm 100% in agreement, but also it's going to be important that we collaborate with other agencies who may have different services in their budget. They may not have psychiatry. We have the psychiatry, but they may have like the bridge program. They may have therapists and, and different things we have the psychiatry in. So really leveraging that and figuring out how to bring everybody together to get it done so we can all save lives here.
Wow, thank you.
Yeah, thank you. And thank you both.
Yeah.
These services are
Yeah.
priceless.
I want to circle back to Theresa and ask, does Access Community Health also provide case management services?
No, we don't. We have care coordinators who do provide some like support in that area, but not to the level of like following people and going to their appointments. We don't, they're all pretty much in-house. But for people who do need case management services, we often refer individuals to Valley Community Support Center, which is in Pleasanton. And I know that they also have psychiatry. They do crisis stabilization as well. And they have on a number of occasions been able to help us and get people medication support too. So we also use them as a resource.
Yeah, they're the county clinic for moderate to severe, and at an equal level as Pathways to Wellness. Is that safe to say, Nisha?
Yeah.
Never along the same level. And okay, well, I was curious, didn't know. Anyone have any other hands up? Your hand is still up, Armini. Here we got Christine. Christine.
I'm curious, so whether one goes to Pathways to Wellness or the place that was just mentioned, Valley something, is geographic, yeah? If they offer the same sort of services, if we're all in Alameda County?
I think I would tend to say geographic, but also according to capacity and accessibility. If whoever can actually provide those services. What I'm finding across the board is there's a wait period to get in anywhere for specialty mental health. So there are some issues across the state. I'm on a couple of different committees, and I'm hearing, other counties trying to figure out what are they going to do to fill this need. I'm not necessarily, I don't know if they go through Access or not, their program, but all of our people must come through Access unless it's in our other clinic, in which I kind of call it the overflow, but it's the Kaiser and the private insurance clinic. There's even a waiting time to get in there because it's more and more people since the pandemic, people who are trying to get services. Mm-hmm.
So I'd like to do a little clarification here. In East Alameda County, we have Access, AXIS Community Health, which is the Access Bridge located in Pleasanton. Alameda County has a program called Access ACCESS, which is the front door into Medi-Cal or county supports and any kind of health around behavioral health matters. And that's kind of the first place you start if you're trying to seek services and you're eligible for the services provided. So just so you don't get too confused on this.
Thank you for making that distinction. I know it's hard. I always try to pronounce it with an access to make sure I'm
I,
not
I spell it
confusing
out,
us with them.
AXIS, yeah. Or not AXIS, yeah. So,
So I have one last question, if we still have time here. I'm looking at the website now, thank you, Marcia, for that. And I know Theresa spoke earlier about acupuncture, chiropractic, right? And I see dental services. I'm just curious, with Medi-Cal, will they get ongoing support in that? Is this part of Access Clinic, or is this mental health specific or general?
That's the general clinic Access Community Health as a healthcare model. So we
Okay.
provide all the different types of care kind of under Access Health. So it's behavioral health services, the IBH services, and Access Bridge are kind of one portion of that. But then we also have primary care services, dental care. So individuals with Medi-Cal can access all these other services as well.
So my
Also-
son goes there for medical primary care, but I didn't know that there's dental, because with Medi-Cal, I don't even know if they get any like preventive service. Is that possible?
Yeah, they can call and get an appointment with the dentist.
And the acupuncture, for example, do they need a referral from the doctor, or what happens? Medi-Cal
they
pays
can-
for acupuncture?
They can call and call directly to get in this. I don't believe they need a referral from their primary for that. They can, if they're a current patient, they can call directly and ask for chiropractic and acupuncture services, and they'll be assessed.
Wow. Bravo. We live in the right part of the world, I suppose. I'm impressed.
Yeah, it's great. I'm so glad we have this extra benefit that it's a new development, I think, I believe the clinics just opened up the chiropractic and acupuncture services. I think are kind of fairly new to Access. We've only had them for a couple of years, and our dental clinic in Dublin opened. I think we're trying to also find and secure a location for dental services in Livermore, but I don't believe we have that yet.
Okay, so it's Pleasanton and Dublin with the dental.
The dental clinic is in Dublin.
Dublin only. Okay. And acupuncture is what location? Pleasanton?
It is in our downtown Pleasanton location, yeah, on Railroad.
Okay. Thank you.
Mhm.
So what happens in Livermore? Just
Well, right
medical-
now things are so we do, before I would say pre-pandemic, we have primary care there, as well as we had behavioral health services there as well. Currently, like I said, all behavioral health services are telehealth, and I don't believe the clinic, I think it's going to be reopening soon. It was kind of closed down for a while. It's a fairly small facility, so they had to shut down during the pandemic, and we were referring everybody back to our location on West Las Positas. But I believe that it's going to be reopening soon,
Okay,
if not already.
thank you.
that's good to know, yeah. Okay, thank you. Any other questions? Yeah. Okay, we're actually pretty close to the end of the presentation time. Okay, we're 15 minutes early, but you know what? I know I've learned a lot tonight, and I thought I knew stuff. So I really appreciate Nisha. Thank you so much for being here to share the information that you have. And just want to
Thanks
thank
for
all.
the invitation. I'm so excited. I was able to hear. I'm excited about the program, the bridge.
Yes.
It's so needed in our county, and I'm so proud to say I live out here and you guys are making it happen. So that's awesome. That's awesome. Whatever we can do to help on our end, please don't ever hesitate to reach out, Theresa.
Thank you so much. Yes, the same. Like I said, our program is growing, and as we're kind of learning the ropes, we're, working out the kinks for our new program at Bridge. We're trying to get more resources, so we're always
Awesome.
have our ear for those resources to try to gather them. So if we can't provide the service, hopefully we can find someone who does provide that service.
Right on. Awesome.
Well, I think we invented the wheel, and I'm very proud to be a resident out here. I truly am, because this is such a mental health in general is just laden with a lot of fear for a lot of people, so they really don't want to talk about it, and we're having the courage to do that out here. And I hope this is a seed that gets planted and that it propagates everywhere, so that people just have access to a real basic need, helping themselves to get the help that they need for their mental health. So with that, I'm going to wrap it up tonight. I want to thank you. There's no meeting in December, so I hope to see all of you, probably Zoom, in gosh, I don't even know if we have a January. Depends on, I haven't even looked at the calendar, but we'll let you know. I think I have everyone's email, and we'll definitely keep you posted. Also, I put the link on for the YouTube, because this recording tonight will be posted at some point, so that you can access it and share it. Please share it. We want everyone in every household out here to know about Access Bridge Mental Health Urgent Care Program. So thank you all.